Welcome back to the Dr. Emily Show. I'm Michaela Hess. I'm an administrator for Great Salt Lake Wellness. I am bringing on one of our clinicians here at Great Salt Lake Wellness. Her name is Angela Schultz. She's been practicing ketamine assisted psychotherapy for years with us, and she's going to share with us a little bit more about the processes and the way that we do it here at Great Salt Lake Wellness. Okay, so we are just gonna hop right into the podcast. We are so happy that you're here. Okay, hello. Welcome back to the podcast, everyone. We are so excited to be talking about ketamine therapy this week, specifically some modalities that we practice here at Great Salt Lake Wellness and Medical. I am Michaela Hess. I'm an administrator at Great Salt Lake Wellness. I have special guest Angela Schultz on today. Welcome, Angie.
Thanks.
Awesome, yeah. So Angie's been working with ketamine therapy for many of years, and she is certified in ketamine assisted psychotherapy, which is kind of what we'll be touching on today mostly. Yeah, do you want to tell us kind of a little bit about yourself and what you work with, Angie?
I'm a therapist, and ketamine assisted therapy is one of many modalities that I'm able to use. And it's really the thing that brought me to Great Salt Lake Wellness. I've been working here for a couple of years because there are just such amazing leaps in healing that we're able to see with people when we combine ketamine and therapy together. So it's such a privilege to get to work with and to get to share and to get to witness, the experiences that people have when they're working with this modality.
Yeah, no, it's incredible just hearing the stories and kind of the testimonials that people have shared is incredible. So can you kind of tell us a little bit about the difference between different types of ketamine therapy and what that looks like as a patient?
Yeah, absolutely. And I think it could be a little confusing if you were just walking into this world for the first time
Right.
and not really knowing what you were looking for, because
Yeah.
there's different clinics, and those different clinics are going to offer different routes whereby ketamine can be administered. What we first started seeing a lot of back in 2019 was Spravato. And Spravato, well, I'll tell you a little bit of the history where this came from. Ketamine has been in use since the 1960s as a surgical anesthetic. It was popular in Vietnam because it could be used on the battlefield, because it was safer than other anesthetics, because it doesn't depress breathing. World Health Organization has classified ketamine as an essential medication because it can be used in rural conditions in impoverished nations without the level of sophisticated monitoring and equipment that we would need for other forms of anesthesia. So it's been around. And very early on, people started to notice there seemed to be some mental health impacts of ketamine. The earliest paper that I've personally read that was published in an academic journal was 1973, like observing this. But no one was really doing anything about it. And probably the main reason is because of the system in our country that we use for getting approval for new medications. It's really expensive to
Quite
do
a
all of the
process.
testing that the FDA wants to look at to say, yes, this medication is safe, it's effective, let's use it. People had a pretty good idea that that might be the case with ketamine, but it was already generic. So there wasn't any incentive for anyone to put a lot of money into testing it. So even though we knew it, we weren't doing anything about it. Then we had one drug company that got the bright idea. Let's go into a lab. Let's move one molecule around. Now we have a new compound. We can patent it. It's called S-ketamine. Brand name was Spravato. So that's what started the current interest in ketamine was actually that process. And Spravato, we see as a nasal spray. It's done in a doctor's office. And that was the first thing. And now it's interesting, a few years later, what we're seeing more often is clinics that are using ketamine rather than esketamine because it works better. But the fact that we had the interest starting to come is what started it. So I'm grateful that we've had Spravato. Spravato is still there. Some people are getting some great results with it. In general, most of the providers you're going to talk to are going to tell you that ketamine seems to work a little better for most people. So at Great Salt Lake Wellness, Great Salt Lake Medical, we don't use Spravato. We actually use ketamine for that reason. So Spravato is definitely one version of how you could have ketamine. Another version, you could have ketamine that's injected. That might also be called IM ketamine. That can be very effective. The downside to doing that is that most providers, to get the effect that they're looking for, will do 2 injections in a row. And so the experience while you're taking that ketamine is you have that injection and it sort of takes you on a little bit of a journey. And then that journey sort of abruptly stops and you're back to consciousness. And then they'll say, okay, let's do it again. And so it's a choppiness. It's a little bit disconcerting to people. So we don't love that one as much as we do another option, which is IV ketamine.
Now,
In
let
that
me
case,
ask
you get an
you,
IV just like you would, like at a doctor's office or, if you were at the hospital, and that's placed directly into the vein. And in that case, it's a very smooth experience. So most patients, if they've done both, will say that they prefer IV ketamine. And another advantage is that if people are really nervous about trying something new, if you didn't like it, you can turn off an IV. You're not gonna turn off an injection once that's happened. So through Great Salt Lake Medical, we do have that IV ketamine available as an option for people who would like those infusions. Fourth version, there's a lot of ways that ketamine is being administered, is that a ketamine can be taken orally. And that's just something that we offer in a cooperative effort between Great Salt Lake Wellness and Great Salt Lake Medical. And when we do oral ketamine, we're combining it with psychotherapy. And this is pretty cool because we've got the benefits. We know that we get the benefits just from the medication. It depends on the study, but about 2/3 of people, who are going in and getting their ketamine infusions is what we prefer, or injections, like some people get, are going to see a reduction in depression, a reduction in anxiety symptoms. And that's even if nothing else has worked. Most of these people have tried so many medications and nothing else has worked. And so it's this awesome breakthrough. But there's even more that we can do when we start combining psychotherapy with it. And so that's the piece that we do. That's using both tools, I guess. We're bringing everything there, the medication tools and the therapy tools together in one as a healing modality.
okay, so many different routes, which I think is amazing because ketamine has been used as a source for treatment-resistant depression, as I've heard amongst clinicians. So kind of why would you use one modality or one method over the other?
I think it is good to really know the pros and cons, is what you're getting at, so that you say, hey, here's what's going to be right for me among all these different choices. So at our clinic, the way that we do ketamine assisted psychotherapy is much more therapy heavy. So we'll have some therapy combined in the medicine session with the ketamine, and then we have a follow-up the next day or two, what we call an integration session, where the experience is process sober. So there's a lot of talk therapy that's involved. When you look at the research, it says that patients who combine their ketamine treatment with some integration psychotherapy tend to have better results, and they tend to have longer lasting results. So if they need a booster session, it won't be as often because they're really getting at the underlying issues that might be impacting their depression or anxiety symptoms. So we recommend, I will say, first of all, for anybody, we think it's great, even if you want to do that IV kind of ketamine, to pair that with some integration therapy a day or two later. And at Great Salt Lake Wellness, we have therapists who are trained in integration, and there's other clinics that do as well. So sometimes people come in and they've already got a therapist who knows how to work with ketamine. That's great. They can get infusions here and go do integration over there. If they don't have that and they like it, we can absolutely connect them with a therapist who knows how to do integration therapy. So there's a lot of flexibility there. We don't require that, but we recommend it because we know that it works better. So that piece, I would say I would recommend on either side. But then if we start to really break it down and say, okay, if I wanted to do an infusion or do I want to do a ketamine assisted psychotherapy, one of the factors is how much talking, how much processing, how much therapist support are you looking for in your journey at this point in life? So, for example, someone who's had some trauma in their background, who has some issues that they would like to work through, having a therapist there might be really helpful, because during that ketamine experience, the therapist doesn't leave the room. They are there. Anything that comes up, anything that needs reassurance, that wants to be talked about, you've got a professional there next to you. And we've got an hour processing directly afterwards. And for many people who have felt like it's hard to talk about things, it brings up emotions. I don't know how to go there. It can be easier in that hour after ketamine. It can just feel more open. It can feel safer. It can be easier for things to flow. So that can be super helpful. Some people might come in not wanting to talk quite so much. And I'll give you an example. Some people that have severe depression, sometimes it's to the point that it feels like it's hard to sit up. It's hard to talk. It's hard to even want to breathe because everything slows down in their system. And so for them, having hours of therapy a week isn't feeling as productive because they're not at a point to be able to really engage and benefit from that. And so really, doing maybe 2 infusions a week for a minute while they really get those depression symptoms down is a better kickstart, and then deciding what they might want to do with therapy if they do afterwards. So, but I think that's the key factor, is at this point in your journey, how much support from a therapist would really be helpful.
Okay. So either way, as a patient, doing the integration is going to have long-lasting effects. Is that right?
Absolutely. That's my recommendation for whichever route you want to go.
Okay. So as an intake coordinator, a question I get sometimes is, well, is it as effective if I'm coherent while in CAP versus I'm totally knocked out having an experience in the infusion? Some people are like, if it's stronger in the infusion, is it just as effective? And does it last longer?
Well, that's an interesting question. And I think that is a good point that brings up the fact that different practices have different protocols that they use for CAP. There's not just one way of doing it. And there are some therapists that will have their patient take a very low dose of ketamine, just enough that they're a little more relaxed, a little better able to talk about things. And that can help them to get through trauma therapy for sure.
Okay.
But it's not the way that we do it. And I'll tell you how we do it. We actually have 3-hour medicine sessions for CAP. And it's so that we can try and get the best of that, let me have a journey kind of experience, and the best of the processing experience all in one. So in that 3-hour session, the first hour, we usually start out talking about what is your intention? And by intention, I mean, what is that patient really hoping to get out of this experience? And we clarify that and we talk about it and fine tune it. We usually have some kind of a grounding exercise. So it might be clinical yoga or guided meditation. I like to play crystal singing bowls if people like that. We really individualize it to what people like. But something that feels like grounding, that helps to create a really comfortable, peaceful kind of setting. After we've had all of that sort of groundwork, which is important because when you look at the research, it says that the setting that you're in and the mindset that you're in are going to impact your experience with ketamine or with other psychedelic therapy. So if someone goes into a setting that feels very cold and very clinical, there's places in the country where emergency rooms are giving people ketamine who come in with suicidal thoughts. And usually the medicine does help. It's a helpful medicine. But it can be a little more scary, a little more amplified because people might be uncomfortable sitting in an emergency room setting. A lot of people aren't very comfortable there compared to being someplace where I've got a soft blanket. I've got some music playing. We've had a routine that we've established that makes things feel really peaceful for me. And so we really build on that piece of research and trying to create an environment that's conducive for healing.
Mhm.
After our patients administer their medication, and they get to self-administer the dose that they would like within a range that our prescribers recommend. So people get to titrate according to the intensity of the experience that they would like. And then while that oral ketamine, we call it a troche, while that dissolves in your mouth, which takes about 20 minutes, we have a ketamine assisted breathwork protocol that we do. And the reason is this was actually published, peer reviewed, research based. This protocol was developed by Dr. Scott Allen. He's one of the leading ketamine researchers really in the Western United States. He's an anesthesiologist. And his research showed that doing this protocol actually increases the bioavailability of the ketamine. And by bioavailability, I mean how much of what goes into your mouth is actually making it to your brain, to your bloodstream. How much of it is lost in the process? And so that's why we do that, because we've done the research and we know what can make that the most effective.
So how does
Then we
breath
have about
work?
an hour where patients get to go on a journey. So very much like what you would have on an infusion, most people are lying quietly, they're having their own experience. The therapist never leaves the room. So if there's a moment that you want some support, that you want to talk about something, you have your person right there. But for most people, that's primarily an inner process, an inner journey of getting to see what that's like. And then the last hour is when we process, so that we've got that experience of being able to talk about things, feeling more open, but also that very personal experience of exploring what that time with the medicine is going to be like for you.
Mm. So it's very designed for the patient just to succeed in every way.
Yeah, 100%.
Yeah. Um, so first of all, I just wanted to ask, because I'm so curious, about why the protocol for the breath work increases the bioavailability and how does that happen? Do you know? And I could also do more research on that too.
I have a great slideshow that talks about all of the science and the biochemistry of it, but I don't think I'm qualified to explain it in great depth,
Okay.
honestly.
Okay.
Yeah.
I'll go and do some research,
You
but
got it. But at this moment, I'd have to pull up his notes because I'm not an anesthesiologist. I
gotcha.
didn't design it.
Yeah. Um, yeah, so kind of tell me why, like, the Great Salt Lake Wellness way of CAP is different and why it sticks out. If you were the patient, yeah, I guess if a patient's asking kind of why our way of CAP is successful compared to other clinics.
What I like about our CAP is, number one, research based. We've done the homework. Even though it's been published, most providers aren't aware that you can use breath work to make ketamine more effective. So we're trying to be absolutely in tune with the best science that we can find. And we are at the same time being absolutely committed to personalizing that experience and to making it holistic, to looking at what's going to work for the whole person. So it's not the same when you do ketamine assisted psychotherapy as just walking into a doctor's office, where you've got sterile cold walls and you're looking up at those fluorescent lights and your little gown thinking this is so awkward. We're not like that. So patients they're either lying on a couch, or sometimes we have yoga mats and cushions that we spread out on the floor. We've got soft lighting. We've got music. We've got blankets, all of these things that are designed to say, let's make this comfortable. And we encourage patients to say, what else would help with this? So would you like to bring a picture? Would you like to bring some additional blanket from home? Are there smells that you like or you don't like? Because we know, again, based on research, that we can pair associations. So most people enjoy ketamine. It's a time that's relaxing. It's a time that's peaceful. It's a break, maybe from feeling a lot of anxiety or depression or trauma symptoms. And so we will talk with them about, okay, how can we start to build that into your ongoing life intentionally? And
Mm,
one way can be taking some time every day to reconnect to what did that feel like? And so by paired association, I mean, if you were wearing a certain hoodie when you had that experience, and you put on that same hoodie, and maybe you were listening to a certain music, and we have multiple playlists available that actually were curated by therapists who have some experience with what tends to work and doesn't work, and patients can completely pick their own playlist, but we've got all kinds of information there to help about what seems to be effective. But to listen to that same playlist again, or sometimes it's pairing a smell, maybe it's an essential oil or something else, can start to bring back some of those feelings to say, okay, I remember this. Let me anchor into this. Let me expand it into this day and the next day, so that that's becoming more a part of their ongoing life. So many ways that we are wanting to work with mind, work with body to help patients really understand and feel safe to be able to access the question of what's underneath all of this. Because if you just go in to a clinic and you say, I'm going to get my ketamine injection or my ketamine infusion, and I'll come back once a month and I'll do that forever. There are people that do that, and I'm so glad that they get to because it's improving their quality of life. But it's also possible that there's a degree of that that's being a Band-Aid because there's some issues underneath that are causing that to be an issue month after month, that if we can put them together, if we can use that medication that's effective to open up some space to say, is there something else that's contributing to this? How can we build into your life the factors that will really make an ongoing difference? We can usually lengthen out that time between needing infusions. Like we can start to have like a whole person kind of healing experience. And ultimately, that's what we want to support people in being able to create.
yeah. Yeah. So it sounds like CAP is really an investment. Um, yeah, you are getting to the root of the problem, the root of why people are feeling this way, and then they're able to take it into their own lives and carry that out. I think that's so cool. I've never even thought of that as something that you can take away and practice in your daily life and just learn those new skills through CAP. That's really awesome. Something I notice doing intakes and scheduling clients is that at our clinic, we really try to make sure that the patient feels like the clinician that they have is a good fit. Like, luckily at our clinic, we have a few different clinicians who do CAP, which I think is really awesome because we will schedule someone with their intake, which is their first appointment, and the clinician will get to know them better. And there's been a few times where they're like, hey, maybe this isn't a good fit. Let's try someone else. And then that way in the CAP sessions, they just feel safe to open up with their provider and they're safe to be vulnerable as well. So that's something else that I think is really cool that we just have options and we want it to feel the most safe and effective for the patient as well.
Absolutely. I think it's so important that there's not just one person.
Yeah.
We've got different providers who are excellent, who have different specialties, different strengths. So we can also match people to someone who has been maybe working for years in exactly the area that they're interested in. So they're
Mm,
bringing in all of that experience, different modalities, different trainings that they've had to say, let me hold that and let me hold you in this ketamine space as well. So now we've got all the tools at your disposal. And that's
mm,
kind of a special thing when you can offer that. Because sometimes, people are relying on ketamine, actually the horror story that I hear the most often. If I have people come in that have maybe done a ketamine treatment somewhere else and they weren't happy about it, was that they were left alone while they were having an infusion or after they'd have an injection. And maybe a memory of trauma came up, or maybe it was just disconcerting because they were having an experience they'd never had and things looked and felt different and they were scared. And that was distressing. And so to really have someone next to you who says, I've taken the time to get to know your history, to know you. You and I both know if something came up, what it would be. We've talked about what we would do. We're prepared to help you. That makes a big difference. And that's actually, that concern is also a piece of the way that we handle infusions at Great Salt Lake Medical. We always have patients bring a support person with them. In that case, we have a nurse practitioner who's administering the infusion, and they're in and out every 10 minutes or so to check vitals, make sure everything is where it should be, see if there's a problem. But they aren't in the room 100% of the time. They're not a therapist. So we ask people to bring a support person that you're comfortable with, because we don't want anyone to ever have that experience of feeling uncomfortable. And like I said, most people enjoy ketamine. They find it relaxing. It's a break from trauma. It's a break from anxiety. But it can be disconcerting as well sometimes because it's something new. Once in a while, we have people that have like a traumatic memory that comes up. And so we want to prepare for everything, to make sure that anything that does come up, it's a healing opportunity. It's not a traumatic opportunity. So we want to be prepared to build that into something that ends up being, when I look back at that, that was a positive turning point for me. I personally don't believe in the phrase a bad trip at this point. After my experience working with ketamine, what I've seen is sometimes people have had experiences that were confusing. They're in the minority, but sometimes that happens, that they were confusing or scary. And if they were left at that, they sort of put it in a door and they close the door and they don't want to think about it anymore. But if they've had a therapist who understands ketamine and has worked with them and said, what does this mean? How do we work through this? Those are usually the turning points in treatment. These are the moments that people look back on and say, that changed everything for me. And I'm so glad that that happened. And so really having someone to support you who knows how to do that makes a ton of difference.
Right. No, that makes so much sense because a client or a patient left alone, they don't know how to handle we're not trained how to handle that. That totally makes sense. And that feels very safe to say that whatever comes up, we will handle it together. Yeah, that's awesome.
And I think that's similar in value. I think that moment of being there in the medicine is really active. When that medicine is active is really important. And it's also important the way that we provide the integration support. So integration therapy is, how do we help you in a more detailed way, like really weave this into your life, like we talked about. And that can make a huge difference, again, in ketamine experiences. So I'll tell you an example, and this is someone who gave me permission to share this story. I was working with a woman who had obsessive compulsive disorder, OCD, and she was working with ketamine to help her to reduce those symptoms. And there was a session where after taking the ketamine, she saw this vision of herself with her chest wide open. And there was this spider, like a big Halloween type spider with its little legs wrapped around her heart. And she was trying to pull it out and she couldn't because it was just stuck. And she got the idea. Okay, I think metaphorically the OCD is the spider, but it was upsetting. It was kind of this disturbing image. And she was like, it felt like nothing was working. And it kind of brought up feelings of ick, feelings of I've got more anxiety. And so working with her, I said, okay, let's ground through this. Let's feeling safe and comfortable. And we worked through it that way. And then when she was ready, we started processing, okay, let's understand this. Because what if this spider thing, what if that isn't some scary bad experience that was a mistake or a side effect? What if this is an opportunity for healing? So we started to explore that. And she said, why a spider? If there were a meaning to this, like why a spider? And it was interesting because she's actually a person who in her real life likes spiders. Like she would go around if there's a spider in her home and instead of stepping on it, she would put it in a little container and take it outside. She had this soft spot for spiders. So if there was something that was going to be scary, why a spider? So we started sitting with that. And she said, if I started treating that spider that represented OCD the way I treat every other spider, it would have been different. I wouldn't have been grabbing it and trying to rip it off my chest. I would have been so gentle with him. And I would have wanted him to find another little spider to play with. And we started really teasing that out. And she realized I have been viewing myself. I've been viewing this mental illness that I'm dealing with such harshness. just no compassion. I've just had all of this hatred toward myself because I have OCD. And what if I switched that up? What if there was time for some compassion and some gentleness? And that was a turning point in her treatment as she started to treat herself with kindness, with compassion, that opened so many doors for her. And so I'm thrilled that she had that experience while she was experiencing ketamine, of seeing that image that seemed scary at first of the spider, because it was important and it was helpful. But if she had been in a room by herself and then she had gone home and there was never any integration therapy, she probably would have just remembered it as that was a bad experience. And it wouldn't have had that healing kind of impact that it did for her.
Yeah. No, that's incredible. And something that came to my mind is that just as humans, we just like want to solve problems. We're like, okay, how do we just get rid of this depression, this anxiety, this OCD right now as quick as we can? And I think it's such an opportunity to be with someone who is also trained in that, but also just taking the time to get to the root of the problem. Because as humans, we're like, okay, just get rid of it, get rid of it. And which is something you mentioned earlier, that sometimes we just throw band-aids on things. I mean, not intentionally, we're just trying to help ourselves, right? But that's such a great experience to just take the time to do that. And I think that probably overall has helped her life, every aspect of her life, probably. She probably thinks more clearly about things and can think more in depth and probably love herself more. But yeah, that's really awesome.
And you think, wow, what level of healing do I want here? Because I think we all want, and I'm not going to lie, me too. Like if I could wave a magic wand and whatever problem I ever face would just go away, I would do it.
Yeah.
I don't know, would you? Like I would. Okay.
Right.
Things are just easy now. But in reality, when we try to do that, it becomes a Band-Aid. It becomes something that it works for a moment, but it may be creating more problems in the long term because things aren't getting addressed and they're not getting taken care of. And so just watching how things work. And you could say, if we're using the Band-Aid analogy, we could say it physically. If I had a serious injury, that needed to have stitches, that needed to be cleaned out, and I put a Band-Aid on it and hoped for the best, it wouldn't heal correctly.
Right.
And emotionally, there's that moment too sometimes when we realize I did what I needed to do, maybe to get through a difficult period of my life, and I pushed through and I was strong. And we have those times, when we do that, and that's admirable. And then we also have those times when we say, it's time to not feel this way anymore. It's time to actually heal this, to get things to a level that it feels like they are taken care of, that we're not just pushing through the same old thing anymore. And so having a space where we're really supporting people in doing that just brings, I think, a value that it's hard to describe.
Right. And mental illness is something that is something that feels unbearable to deal with. And it also feels like when you're in a hard time mentally, your vision is super narrow. And so you don't think about all of these opportunities to heal. Think about what is going to help right now. But I think it's so amazing that we have all of these treatment options now and that we can actually get to the root of the problem. I think that's incredible. And yeah, that's awesome.
And one benefit of ketamine is that it actually does work more quickly than most other treatment modalities.
Okay.
So for anyone who's been prescribed an antidepressant, they've probably been told the same thing, which is, well, let's give it 4 to 6 weeks and we'll see how you're doing. And then maybe we'll adjust the dosage.
Which feels like a lifetime.
And then maybe in another 4 to 6 weeks, we'll adjust it again. And if that's not working in another 4 to 6 weeks, maybe we'll try something else. And that feels like forever.
It's hopeless.
If you are struggling. Yeah. That's so long.
Mm-hmm. Totally.
But for ketamine, one of the benefits is that it is fast acting. So typically what we do is a 6-session initial series. For our infusions, we'll often stack those more closely together. It might be twice a week. I've seen people sometimes do 3 of them in a week. So it might be 2 or 3 weeks that they're getting through that infusion series.
Mm.
For our ketamine assisted therapy series, we usually do it once a week because we're doing that therapy intensive aspect of it. So that's usually 6 weeks um, to finish the initial series, not to see, oh, do I need to adjust the dosage? And
Right.
so people are seeing benefits before that. Some people see benefits as soon as the first session. For some people, it's maybe 3 sessions, but so much faster, than
Right.
what we're typically looking at. And the same thing with therapy. We've got lots of therapies that are evidence-based that can help with trauma or depression, but they take time.
Right.
They're not happening as quickly. And so one of the cool things that ketamine can do is it can really create an openness in the mind for insights to come in, for the things that maybe people have been going to therapy forever. Sometimes I see people who come in and they're like, I could write the therapy book at this point. Like, I know like the kind of thoughts that would be healthy. I know the behaviors that would be healthy. I believe it. I just can't get my brain to do it.
Mm.
And I'm feeling so stuck. And so ketamine can be great in those situations for sort of bridging that gap. Ketamine actually increases neuroplasticity.
Mhm.
Neuroplasticity means your brain's ability to grow and to change and to do new things. So if you're trying to do that thing that you know would help, but you just can't get your brain to do it, doing that when you're in a ketamine series is going to be so much more effective. If you're telling yourself the thing that everyone's been telling you, your therapist's been telling you, your friends have been telling you, heck, you're telling yourself, like this is the thing that would help. Telling yourself that thing when you're taking the ketamine, all of a sudden it penetrates.
Mm.
All of a sudden it expands and there's insights and you're like, oh my gosh, I get it. I've had so many patients say things to me like coming out, I finally believe that I'm worth loving.
Mm.
I didn't really believe that before. I tried to believe that. People told me, but I feel it all the way through right
Mm.
now. We get those kinds of comments from people that are going through ketamine. And so it's this really way of making things that have been on the surface that you've been trying and trying to really be able to sink in and do what they're supposed to do. Ketamine is an amazing adjunct for all of those things.
Mm. Yeah, and actually being able to execute what you're wanting to do and grow and take leaps and bounds in that way. Yeah, that's so good. Mm.
And our clinic, we actually have both individual and group options for ketamine assisted psychotherapy. And so
Mm.
that, gives us even more ways of working with people. Um, and why would people choose one or the other? Um, Groups are a little less expensive, so sometimes that helps budget wise for people. But there's also some unique experiences that are associated with it. I've had so many people tell me after a ketamine group, I loved these people. I loved that I was sitting here and they were talking about their experiences and it resonated,
Mm.
and I could feel it. I could feel this empathy toward them. I could feel where it applied to me. Everything made sense. I felt supported. I didn't feel like I was alone in the things that I'm experiencing. And so for people who would like that kind of an experience, it's a wonderful thing,
Mm.
that we can go in that direction as well.
Right. Um, so something I hear a lot from patients when we're scheduling, they're like, this sounds incredible, this sounds like a great idea, but um, it does cost a hefty amount, right? And it's not covered by insurance. So kind of what would you say about that? What do you have to say about that to a patient, kind of?
Absolutely. Well, the good news is we are now billing part of our ketamine assisted psychotherapy to insurance.
Mm.
And we're excited because that can increase access for a lot of people. It's so helpful when we're able to do that. There's a portion that's cash pay as well. Um, and what I would say about that is if we can make groundbreaking kind of strides, if we can take 6 weeks and accomplish things that people will, I worked with a client today who said, I saw half a dozen therapists over years before this, and it never worked. And now
Mm.
it's stuck. Like, how much are you investing of your time, of your energy, of your money in copays, and of just life that you've missed? when you don't get to fully experience joy, when you don't get to fully be present with your family and your loved ones, when you don't have the energy to progress in the things that you want to, and we could change things in 6 weeks, how much is that worth?
Right.
I think financially, actually, it ends up being a deal compared to what people spend trying medication after medication, um, trying therapy if it's not working for them. I think it's financially a deal. But when you start looking at the other factors that play in, that's priceless.
Right.
I think we could charge far more than what we do, and it would be worth it.
Mm.
Because what is it to change a life, to bring someone back to life? And I don't think we charge what it's worth, because we want to help people. We want it to be accessible, and so we're trying to do that. We've got to keep the doors open because we're a business. But to even quantify how to do that, I
Mm.
don't know. It's just such a privilege to be
Mm.
able to be a part of it, to be able to make it available for people.
And yeah, you see the actual work with the clients. You are in the sessions. So it's probably easy for you to say, "Oh my gosh, this is so worth it." And yeah, I wish we could show a chunk of that to patients and everything, and how valuable it is. Yeah, I love that.
Yeah. And at Great Salt Lake Wellness, we don't ask for patient reviews. And the reason we don't is because we're a practice of therapists. And we don't want there to ever be an ethical sense. If I'm a therapist saying to the person I'm working with, will you write a review for me, that they feel obligated in any way, that somehow this relationship that we have would be um, altered by
Mm.
that, and so we don't ask. I mean, people could do that if they wanted to, but usually people don't think of it, unless we ask. But at our sister company, Great Salt Lake Medical, where we do infusions, because those are not mental health therapists, they are in fact able to ask for reviews, and there's some that are published on the website. And
Mm.
so looking at those, these are actual people just here in Utah. These are people who are part of our community, and the kinds of things that they have to say is really cool to look at.
Mm. Um, Also something, so ketamine and cap, super awesome, fast in the way that it works. It's lasting. So what's the downside? What's the catch? What are the side effects?
Okay, what's the downside? Well, like anything, there's not a guarantee it's going to work for 100% of people.
Mm.
When you look at the research studies that have been published, I would say 2/3, sometimes 80%. It depends what study you're looking at, are getting the results they're wanting. They're having that improvement. And there is a percentage of people that won't. However, the people in those studies are, for the most part, people who have treatment resistant depression. So these are people who have tried everything, multiple medications and therapy, and nothing's working. So the fact that we can help 2/3, sometimes 80% of them with a medication is mind blowing.
Right.
Wow. Like, there you'll find, if you start Googling ketamine, you'll see the term breakthrough treatment used a lot, because it is so revolutionary to be able to have that much success. Because over the last 30 years, basically everything that we've had coming out in the mental health sphere has been some version of the same thing. It's been an SSRI, like that's a cousin of Prozac, or an SNRI. Um, and the people that those don't help, they just bounce between different versions of the same thing. And so nothing's helping them. So yeah, we can't guarantee that you won't be one of those minority of people that it doesn't work for. However, the good news is, when we're taking those numbers, those are the people who nothing else has worked for. Those are the people who are just like you. If you have treatment resistant depression, that the majority of them it helps. So I want to draw that
Mm.
distinction, which is kind of a cool thing, because when we're looking at results of how effective are our standard antidepressants, they're not, for the most part, doing studies on treatment resistant depression.
Right.
Right. They've got a much easier kind of tool that they're trying to help.
Mm.
Side effects, there can be. Some people will experience nauseousness or vomiting. in association with ketamine. That's really the biggest side effect that we'll see. Our prescribers typically encourage everyone to take some Zofran. It's just a little pill that dissolves in your mouth that helps with nauseousness. And for most people, that's more than enough. In my experience, most people don't actually have nauseousness even without it, but we try to really just double check because we wanted people to have the best experience possible, and it's not fun if you get nauseous.
Right.
Once in a while, people might need more than that. I'm one of those. My patients hardly ever are, but I'm one that if I take ketamine, I need multiple anti-nauseousness medications. And that's okay. Like if someone is in that category, we'll fine tune it. Like, what do we need to do to actually make you comfortable so that you can have the experience that you want to have with it?
Mm. And I know the clinicians, I've seen before where if someone gets more nauseous in one of the infusions, the next one, they're like, hey, do you want me to pump a little bit more of the Zofran into the infusion? Which I've seen help some people a lot.
Yeah, so they can do the IV Zofran with the infusions.
Yeah.
We do oral Zofran for people who are doing ketamine assisted therapy. And there's other medications you can take orally as well. You can
Right.
also do a scopolamine patch. It's the little patches that people wear behind their ears when they go on a cruise. Those work really well with ketamine.
That's cool.
Yeah.
Huh.
So if you want to just, sometimes people talk about ketamine, I'm going on a journey. You can go on a journey. You put on your scopolamine patch and you're good to go, and we'll keep you from being nauseated, just like we would do if you want to go on a cruise for someplace on spring break and you don't want to deal with too much nauseousness. We fine tune it. We find a way to make it work for you.
Yeah. So we're almost running out of time, so we can wrap things up. But yeah, overall, kind of the side effects are pretty low risk. I wanted to ask really quickly about how ketamine helps with suicidal ideation. I've heard that that's a fast acting.
Yeah, it actually, and that's one of the areas that's gotten a lot of attention for ketamine because it does help very quickly in certain cases. There are parts of the country where if people go to an emergency room with suicidal thoughts, they're giving them ketamine because sometimes as fast as the same day, the suicidal thoughts just aren't there anymore. And some people take more than one treatment, or sometimes people take the ketamine and it kicks in the next day. So it's not a guarantee it's always the same day. Sometimes it's that fast. It's certainly faster than any other treatment that we have. Any of the other antidepressants, we're looking at usually at least a period of weeks, and sometimes well beyond that. So for someone who's really struggling, I think it's a great frontline treatment. Let's ensure safety. Let's really get you to a place where you can be okay again. And I think that I've been in the situation personally of having people I love who have had suicidal thoughts, and that I know that for me, there's nothing that's more important than keeping them safe. And it's hard to be in that situation of thinking, what can I do? What's really going to work? And so it's great when you can look at evidence, that's published in medical journals that says this is a really powerful intervention. And I would definitely want people to know that this option is there if you've got a loved one who's struggling, that could be really helpful for them. And absolutely, I've seen people who feel like it has saved their life, who've said to me, I think that ketamine has saved my life.
Yes. I personally, a few years ago, I tried different medications. My doctor told me, okay, your depression is treatment resistant. And years of that, it feels so hopeless. And you're like, there is no way out of this. But I tried ketamine and it was a miracle the first time, when there was just the relief of not feeling suicidal after. And that was like more than what I had asked for, right? After one treatment. So yeah, I'm definitely one of those that it did save my life for sure. Yeah, I just wanted to throw that in there just kind of as a little testimonial just of how powerful it can be.
Yeah, thank you for sharing that. I think that when we start talking about our stories, and there are a lot of stories, because there are a lot of people that are starting to get familiar that ketamine is becoming more widespread, of saying, this really could be something that I want to try. And so
Right.
then you start looking at, okay, how do I want to try it? Like, what's going to be the option that's going to allow me to have that healing that I'm looking for?
Yeah. And if you are a patient, we can help you figure that out here as well. We have so many tools to direct you and guide you in what might be best for you. So, yeah, do you have any last thoughts on our discussion today?
No, just thank you for the opportunity to spread the word, to talk about something that I love, that I'm passionate about. I've seen it in my family members. I've seen it in people that I work with, that we've got this amazing tool, and I just want the world to know about it.
Yes. Yeah. I think it's awesome. And if you do have a family member, or if you do yourself, even if you're questioning, should I try this? Should I not? Maybe send it to someone. I think it's just great to spread the word about more treatment options. Yeah, that's ultimately what we're trying to do. So, yeah, thank you so much for coming on and sharing. This was so informative and helpful. But yeah, I appreciate you.
All right. Thank you so much. Appreciate
Yes,
you.
thank you, Angela. All right. Okay. All right. Thank you so much for listening to the Dr. Emily Show today. Please follow us on Instagram and subscribe to our YouTube channel if you're not already. And we will talk to you soon.